Welcome to Daytime Ottawa here on Rogers TV. I'm so excited to talk to my first guest because she is one of 12 finalists for the 2023 Student Entrepreneur National Competition that's coming up May 1st to 3rd. I am joined by Elisabeth Mercier. She is a full-time student at the University of Ottawa, and she has a company called Advanced Environmental Molecular Analytics Limited. Quite a mouthful, but you said, well, we call it
AEMA.
AEMA from now on.
Exactly.
First of all, congratulations. I mean, what an incredible accomplishment. Before we talk about the competition, though, let's talk about the inspiration behind what you've done to get into this competition.
For sure. So I started as an undergrad at University of Ottawa. I was part of the Enactus team, which really helps students get into social entrepreneurship so that your studies kind of seems a little bit more connected to the action and implication you have in your community. So I started there. I founded a project around water. It was around drinking water to help Indigenous people have more access to drinking resources.
Right.
And then I pivoted and I kept doing my research for my master on wastewater surveillance. And then COVID hit, and then we figured, what can we do to help the pandemic? And that's when we got into this whole wastewater-based epidemiology thing.
Yeah, so when it comes to wastewater-based epidemiology, how does it work? I mean, explain it to me like I'm a 5-year-old, 6-year-old.
For sure. So when we're sick and we're infected with a virus, when we go to the bathroom, little pieces of that virus is going to be excreted into the sewer system.
Okay.
We're not talking about viable virus, just a little piece identification, kind of like your ID card. It's not you, it's just a little piece of identification.
Right.
And then because everyone goes to the bathroom, you can start shedding prior to starting to feel bad and wanting to go and get tested. So as you're just using your bathroom, then all of those virus particle aggregates to the wastewater treatment plant. And in Ottawa, there's only one in the city that captures most of the population, almost 100%. And then from there, we grab a sample, and then we're going to measure how much virus is in that sample for a given day. And if we see the virus going up, then we know there's more people being sick in the population. And if it's going down, then less people are recovering, and there's less virus in general.
So then how do you measure those pathogens within wastewater?
For sure, and that's what I brought here. So can you guess what this is?
No.
So that's actually a passive sampler. So when there's no electricity, so we do wastewater surveillance not only in big cities, but on like universities or up north where there's not always electricity. So the water is going to pass through, and then the solid particles where the virus particles are stuck will go into it, and then we have an absorbent material that we just take out and then we ship it to the lab.
Okay.
And that's what we measure it. And then this is usually here, this is actually wastewater from this morning. So everyone that went to the bathroom yesterday, you might be
this
here.
Could be part of your waste.
Contribution, I like
that. I like that.
So we concentrate, so you see here it's kind of like liquid. We concentrate that, the viral particle, and then we use a very small thing here. That's just like a filter, kind of like your coffee filter, and then you're going to pass all of the material that goes into here with obviously a little bit more preparation, and then that concentrates the virus into that little filter.
Right.
Then we elute it, and then we take that and we do a PCR. PCR is what we've been doing for the past 2 years with COVID when you're sick. It basically takes the amount of virus you have and it amplifies, kind of like a photocopier. You make a bunch of copies of virus until there's enough for you to be able to measure it.
So what did you find out as you measured? Of course, I guess, that in the media, we heard it quite often, right? In that you could actually measure what the percentages might look like, right? I guess it's not an exact science.
No, and it also, like, when you're looking at, let's say, hospitalization in clinical case, it's people that are feeling sick enough and being measured. What we're measuring in wastewater is everyone that is sick using the bathroom. So what we find is that we're able to follow when there's an increase in cases in the population and when there's a decrease based on the amount of virus. And that is, you don't depend on clinical testing availability to be able to know that.
I see.
And again, often we see that days or weeks in advance because you can be infected with the virus prior to feeling a little bit uncomfortable and needing to go and get tested.
Right.
Yeah, and for, let's say, example, RSV or influenza, that's not something anyone can go and get tested. Like, it needs to be,
of course.
If you have you need to fit certain criteria. So there is those cold, which for people, like the people that are not at risk, so health conditions or older or younger, they don't really need to get tested, but that's important information for protecting our more at-risk people. So that's why when we're measuring in wastewater, it's not necessarily for everyone that information, but it's to give a more precise view of what's happening for public health so that they can help really protect the one that needs it most.
So when it comes to using this in the future, wastewater epidemiology, how can it help in the future?
Yes, so the goal would be, hopefully, knock on wood, no more pandemic, but again, pandemic preparedness, because we're able to see it days in advance, so we could track, see where they are, so have a little bit more targeted approach in terms of lockdown and things like that, but also just for the management of influenza and RSV that actually burdens our healthcare system every year. Can we identify when that season starts? Then we can do more prevention. There are some drugs that needs to be administered throughout the season of RSV for more at-risk children. Then this is a more focused drug application that then reduces the cost for healthcare. So there's a lot of things like that, and it's moving to cancer markers and things like that. So there's a lot of stuff, a lot of way that it can be used, and also for things that are a little bit more uncommon, like monkeypox or measles. That's not something we often have.
Right.
So it's not something we want to go and test everyone, but we want to have a pulse. If it comes in the population, we know it's there. We do quick action, and then we prevent it from spreading more.
You mentioned we have that one wastewater facility. Could we eventually narrow things down a little bit more and actually target specific regions in a city?
Yeah, exactly. So we've done that with more vulnerable population, and we're talking about long-term care home or shelters.
Right.
That's where we use this thing here, and that's basically is also to help bridge some of those health inequities, because not everyone is as represented in terms of clinical testing. So using those to have a more targeted approach is also helping to make that they're a little bit more represented in terms of following their disease that's happening there.
I mentioned you're one of the 12 finalists coming up in this national competition. So how did you get to this point?
I had to apply with the business. So then we filled out, we said here, we've been working on this since 2021. And then we apply, we're finally having some contracts, the following of the plane that are coming in Canada. So we're helping analyzing that. We have some contract with mines and things like that. So we're slowly growing. Hopefully our goal is really to make this more accessible to people that would need it and can benefit from this health information.
Can people sort of follow your journey with with the competition? Are you posting on social media?
Yeah, I'll try to post on social media. If not, Enactus Canada is really good on posting about everything that's going to happen. So definitely just follow there, and that would be great.
I guess they whittle it down, and then they whittle it down to the top two. And what would the top two receive for winning the competition?
The top first gets $10,000 and $2,000 for the follow-up. Yeah, so a good amount of money to help grow those businesses.
Well, and to help pay off, if you're studying your PhD, like someone like yourself who's going through 6 or more years of schooling. Elisabeth, thank you so much for joining us. Really appreciate it. Congratulations. I mean, this is just incredible work. It's amazing. I've said this so many times. Amazing what young people are doing in our communities across the country, and this is just another great example of that. Don't go away. We've got lots more daytime coming up right here on Rogers TV.